Your smile is more than just a warm greeting. It may actually be the best indicator of your overall health, because many medical conditions are linked to gum disease. That means your dentist could be the first medical professional to uncover a serious health problem.
We find that there are a number of systemic medical conditions that are associated and can be identified in the mouth, one being diabetes. Another one is a possible association between periodontal disease and cardiovascular disease, and then as well with low birth weight preterm babies and pregnancy.
Nourishment is also a critical component to overall health. Being able to properly chew is the only way to ensure you're getting the nutritional benefits your food has to offer. Chewing can present a challenge for people with missing teeth, dentures, or bridge work.
Being able to chew your food properly is very important for the long-term overall health because it allows you to metabolize the food as you have chewed it thoroughly, and to be able to then metabolize it and get the value nutritionally from the food itself. And if you're not able to chew your food properly, you end up swallowing it whole, and then you end up having gastrointestinal problems, and that can result in the consequence of some major medical problems as well.
Today, dental implants are revolutionizing the field of dentistry. Unlike dentures, dental implants look and feel like natural teeth. They're even more durable than your own teeth and won't decay.
Beautiful. Okay.
A dental implant is an artificial tooth root placed into the jaw to hold a replacement tooth or bridge.
The procedure of placing a dental implant is actually very straightforward. Of course, one wants to make sure that you have adequate bone to be able to have the implant properly placed, but the actual procedure itself is very easy. It requires some local anesthetic in the area that the implant is to be placed. A very small incision is made in the gum, and then we use very specialized drills that drill down into the bone that then allows us to properly widen the diameter of the hole that the actual dental implant or anchor is placed into the bone itself.
Barbara Killerlane had dentures for years until she heard about the benefits of dental implants.
I had a partial that was anchored to other teeth, and one of the anchor teeth broke. And in going into the possibility of repairing it and getting another partial, I decided that I didn't want to do that any longer. And so I decided to go into implants, and very successfully.
Okay, Margie, go ahead and bite down for me now. Good job. Perfect.
As dental implants gain in popularity, more and more dentists are offering them to their patients. However, it's important for patients to choose wisely when selecting a professional to perform this procedure.
If the implant is in the wrong position, you can end up perforating the wall of bone and create some problems with the soft tissue. If the implant is placed too deep, you can actually cause some permanent nerve damage. And so it's extremely important to have a surgeon who has the training and the qualifications to be able to understand the parameters of the bone and the soft tissue to be able to give complete success for the ultimate placement of the dental implant.
After a successful treatment, Barbara is thrilled with her new smile.
I feel my new smile is an improvement. I had some crooked teeth and prominent teeth, and now they are all even. They feel wonderful. I feel like your natural teeth. I would recommend them for anyone who has had a problem mouth, and this, I think, has been the solution for me.
You know, there are many times patients ask me for advice on what we can do to help them with a bridge that is unsightly, or a denture that doesn't fit, or a partial denture that is extremely uncomfortable. And the good news is that with the placement of dental implants, we can eliminate the removable aspect of the teeth or fix that hole that's present in their smile, and they come out with an absolutely beautiful smile. And so it's very important that when you choose to have a dental implant placed, that you do your homework. Find out who the individual is that is offering to surgically place the implant, find out how many implants that they've placed, find out the kind of training that they've received, that you make sure that the permanent solution to your smile is done by someone who's qualified and somebody who does this on a daily basis, and that leaves you feeling confident that your smile will last you a lifetime.
Dr. Jean Salcetti is a surgical specialist with advanced experience in placing dental implants. As a board-certified periodontist, Dr. Salcetti has received the highest training and gained significant experience on dental implants. At her practice, Salcetti and Associates, Dr. Salcetti works with a team of dentists to transform the smiles of her patients.
The main goal of Salcetti and Associates is to provide superior dental care to our patients in a setting that is warm and comfortable, with a staff that genuinely cares about you and the quality of the dental care that you're going to receive, and ultimately to give you the best dental outcome that we can possibly provide. One of the services that we provide for our patients is the opportunity to have IV sedation. This allows us to give sedative drugs intravenously during the entire course of the procedure itself. This allows the patient to be very comfortable, asleep. They're not aware of the time that has passed. In order to provide the IV sedation, I have chosen to have a certified nurse anesthetist as the individual who provides that care for the patient. That allows me to do the surgery and to focus on the work that I'm doing, and it allows the nurse anesthetist to monitor the vital signs of the patient, their blood pressure, their pulse, their breathing, the amount of oxygen that they're getting, and that way the patient gets the benefit of both worlds.
Dr. Salcetti and her team take a personal approach to every patient. She evaluates each case individually and creates a unique treatment plan. Her personable style and skilled technique has won over hundreds of patients.
My implant is the closest thing to my natural tooth, and no one can tell that I have an implant, even though it's my front tooth. And my implant looks, feels, and it functions just like my natural tooth. Dr. Salcetti is going to do the kind of work in your mouth that you would expect in hers, and she's very professional and a perfectionist.
I chose a dental implant over a bridge because it gives me such a natural looking smile, and I especially enjoy the comments I receive from others when they tell me how nice my teeth look. I would recommend dental implants to someone over a bridge because it's so natural. It feels normal inside your mouth, it feels like your real teeth, plus it gives you such a natural looking smile, and it's so easy to clean, no different than your regular teeth.
Dental implants continue to be the most reliable option for tooth replacement. Once Dr. Salcetti has given your smile a makeover, your dental implants can last a lifetime.
I enjoy coming to Dr. Salcetti's office to have my dental implant work because it's a modern office. It's got all the latest features that you would expect in a dental office. The staff here is very lively. They greet you with smiles on their face, and they can't help but make you smile as well. I've had another dental implant elsewhere, and it was so much more relaxing in this office with Dr. Salcetti.
Well, Dr. Salcetti was recommended to me by one of my friends, and I would recommend her unhesitantly because she's a very kind, very gentle person, and yet she's very professional. And her attitude is, I thought, was outstanding.
As new dental techniques emerge, Dr. Salcetti and her team will continue to stay ahead of the curve, offering the latest procedures to patients in the Colorado Springs area.
The primary goal for the long term for my practice is to continue to stay on top of the technology of what is available, not only in terms of the surgical placement of dental implants and the diagnostic imaging. We're going to be bringing that to our office and make that extremely easy for patients to have the images that need to be done for implants here in the office, as well as the diagnostic tests, and to provide just the ultimate superior care for our patients that we can provide.